Hey, it's Mark from EndAllDisease.com here, and I've got another fantastic presentation for you today. I've been working on this one for a few weeks now, and I'm very happy with the way it turned out, so I'm excited to share it with you. I hope you learn a lot. Here we go. Aching, swollen, painful. I'm describing the joints of millions of people who suffer from arthritis. Their hands feel sore, everything takes longer, and even simple tasks like taking out your phone and texting somebody becomes challenging. For the younger people who are listening who think it'll never happen to them, listen up. Arthritis used to be thought of as a disease of the elderly, but today it's common among young people. For example, in Brazil, 33% of people over the age of 25 have osteoarthritis. It can happen to you, and there's a good chance it will. Almost 55 million US adults were diagnosed with some form of arthritis between the years 2013 and 2015, and tens of millions every year since then. This amounts to hundreds of millions of people suffering from arthritis, and yet, as you're about to find out, all the treatments a medical doctor can offer you suppress the immune system. Even people who know nothing about health know that switching off the immune system is not a good idea. It's your first line of defense against disease, and lowering it increases your risk of death from cancer and virtually all diseases. In this presentation, you'll learn what arthritis is, the mainstream approach to treating it, and how red light therapy can help you live free from the pain and discomfort of this crippling ailment, quickly, inexpensively, and with zero side effects. Be sure to stick around until the end, and I'll show you the exact red light treatment time needed to achieve the greatest possible results with this device right here.
Welcome to the End All Disease Podcast, where it's all about doing your own research, making your own decisions, and speaking the truth without fear of the consequences. Here's your host, Mark Sloan.
Arthritis is a disease characterized by swelling of the joints. It's usually associated with pain, restricted range of motion, muscle weakness, difficulties in daily living activities, and impaired quality of life. According to mainstream medicine, there are more than 100 different types of arthritis and related diseases. The two most common types of arthritis include osteoarthritis and rheumatoid arthritis. So here are the mainstream theories of the cause of these two types of arthritis. Osteoarthritis is said to be caused by mechanical wear and tear on the joints, and is the most common form of arthritis. It's about 10 times more prevalent than rheumatoid. Rheumatoid arthritis is said to be an autoimmune disease in which the body's own immune system goes into overdrive and begins attacking its own joints. Mainstream medicine has no explanation as to why this is, so they believe in just treating it. Treating the symptoms, never really going after the cause because they don't know it, right? But some suggest a viral infection as the cause. In a future video, however, I will cover the concept of autoimmune disease, and I'll present a far more likely explanation, with much better solutions, of course, as well. There you have it, mainstream. Now, the mainstream treatments for arthritis. So there are hundreds of different types of medical drugs and surgeries used to treat arthritis. There are multiple types of treatments and surgeries for each type of arthritis, and as you know, there are 100 of them, so there are literally hundreds of options here, and here are a few common types. Steroid medications or injections. The administration of the stress hormone cortisol is what is used for these, and it switches off the immune system, which reduces inflammation in the short term but accelerates the disease process in the long term. So for osteoarthritis, they inject corticosteroid directly into the joint, and the people receiving this treatment are told that it will only last months or years at most, and they'll have to get it done again. And in fact, because it's a stress hormone, it's actually making the joint worse over time. And for rheumatoid arthritis, corticosteroid medications are administered orally. So it's cortisol either way, and this hormone is literally the cause of aging and disease. It's stress in the body. For osteoarthritis, corticosteroid is injected directly into the joint. And of course, over time, this will make the joint much worse, and it is far from permanent. And for rheumatoid arthritis, corticosteroid medications are administered orally. And either way, what we're talking about here is cortisol, which is stress in the body. DMARDs, yes, that's an acronym standing for disease-modifying anti-rheumatic drugs. These drugs work by directly inhibiting the immune system and include the chemotherapy drug methotrexate. Anyone who's read my book, The Cancer Industry, knows the incredible side effects of chemotherapy. Side effects can include heart disease, stroke, depression, infertility, and cancer. That being said, these are much lower dose. However, putting a poison in the body and expecting it to heal is insane. NSAIDs, another acronym, another class of drugs used to treat arthritis. NSAIDs stands for non-steroidal anti-inflammatory drugs, which work by inhibiting the enzyme COX-2, which prevents the conversion of polyunsaturated fatty acids into the highly toxic prostaglandins. Prostaglandins, by the way, dominantly enable tumor development and progression. So this is actually a fairly scientific way to treat the disorder. However, NSAIDs are highly toxic, which suppress the immune system and increase the risk of heart disease and cancer. That being said, there is one NSAID which really doesn't even belong in the class because it is not toxic at all and it actually prevents cancer and heart disease, and that is aspirin. But your doctor probably won't recommend that. So, the scorecard for mainstream medicine in the treatment of arthritis, what we have here, all treatments for arthritis offered by mainstream medicine are designed to suppress your immune system, increasing your chances of death from all causes. If that's the way you want to treat yourself, go for it. Now you understand at least what is going to be on the table if you do decide to take that route. Now I'm going to show you some alternative concepts and ideas as to what the cause of arthritis likely is and the impact of red light therapy on arthritis to see if that can help you safely and effectively reverse and even remediate the root cause of the problem that's giving you the arthritic pain, inflammation, and other things. Can red light therapy treat arthritis? Dr. Raymond Peat has a fairly infamous quote now on arthritis. He lives at least part-time in Oregon in the United States, spends a lot of time in the mountains in Mexico, from what I hear as well. One thing Oregon is known for is its gray, cloudy skies and lack of sunlight all along that west coast. So here's Ray's quote. Many people who came to cloudy Eugene to study and who often lived in cheap basement apartments would develop chronic health problems within a few months. Women who had been healthy when they arrived would often develop premenstrual syndrome or arthritis or colitis during their first winter in Eugene. Now we're going to get into some scientific evidence as to what the root cause might be. And unbelievably, it's actually pretty well established. Recent research has shown that nitric oxide plays a central role in the pathogenesis of autoimmune diseases, rheumatoid arthritis, and lupus. Here's a quote from a study. Nitric oxide-dependent tissue injury has been implicated in a variety of rheumatic diseases, including systemic lupus, erythematosus, erythematosus, and rheumatoid arthritis. So, to me, what that is suggesting then is that autoimmune diseases are less a function of the immune system going berserk and rejecting your own tissues and attacking you, and more of a function of widespread bodily tissue injury. What this study is showing that is that tissue injury is dependent on one specific factor, and that's nitric oxide. As it turns out, red light therapy reduces nitric oxide production by inhibiting the enzyme nitric oxide synthase. Based on the fact that red light reduces the factor that is central to rheumatoid arthritis, it seems likely that red light will provide benefit to people with arthritis. Let's take a look at some studies to find out what the research has found in humans and in animals. Dr. Michael R. Hamblin, Harvard professor from the Department of Dermatology, who has been researching red light for decades and is one of the most respected researchers in the field, published a study in 2013 titled, Can Osteoarthritis Be Treated with Light? The study experimented with the application of near-infrared laser light on arthritis in rats. A single application of low-level laser therapy produced significant reductions in inflammatory cell infiltration and inflammatory cytokines 24 hours later. Or put simply, One single treatment with a near-infrared light significantly reduced inflammation. Next, we have a 2007 review done on humans. So this is a review of 36 randomized placebo-controlled trials, which included a total of 2,434 patients on osteoarthritis knee pain. 7 different treatments were tested in an intensive 2 to 4 week treatment regimen. So this will be fascinating to a lot of people who have tried and who are into alternative treatments. So ineffective for pain relief were manual acupuncture, static magnets. Ultrasound therapy was also found to be ineffective for pain relief. Effective for pain relief, we have 4 different treatments. Pulsed electromagnetic fields. I used to have one of these. It was a mat that you would lay on called the MRS 2000. And I would lay on it, and it would basically create a pulsed electromagnetic field about 2 feet high that would protrude right through the body and relieve pain. And this study confirms or validates that. Transcutaneous electrical nerve stimulation, electroacupuncture, and of course effective for pain relief also was red light therapy. Interestingly, the positive effects of these treatments lasted at least 4 weeks post-treatment. And when researchers analyzed the therapies based on what appeared to be the most optimal doses, red light therapy came out on top as the most effective for short-term pain relief. Now we have a 2000 review of red light therapy for arthritis. This review was conducted in the year 2000 by researchers from the University of Ottawa. 5 placebo-controlled trials were included, all of which tested red light therapy on patients with rheumatoid arthritis. The following benefits of red light therapy were found. Red light reduced pain by 70%. Red light reduced morning stiffness by 27.5 minutes. And red light increased tip to palm flexibility by 1.3 centimeters. Researchers suggested that future research should be focused on determining specific optimal treatment doses to get the maximum benefit from light therapy. So basically what they're saying here is we have enough evidence to know now, beyond a shadow of a doubt, that red light therapy is effective for arthritis. And we need to narrow down our focus, just like a magnifying glass when you're trying to burn a bug when you're a kid. You narrow that down so the beam of light is more intense and you find the answers you're looking for more effectively. Some doses are more effective than others, and we need to determine which ones are the most effective so we can give people the best chance of healing and make red light therapy the most medicinal it can possibly be. Now we're going to move on here to a study from the University of Dammam in Saudi Arabia in 2016. In this study, researchers experimented with 2 different doses of red laser light added to an exercise training program in older osteoarthritic patients. So patients were assessed for joint pain, joint stiffness, physical function, isometric muscle strength, range of motion of the knee, and quality of life. So the protocol consisted of 2 sessions of exercise plus red light per week for 8 weeks, for a total of 16 sessions of red light combined with exercise. Group 1 received a 6 joule per centimeter squared dose. Group 2 received a 3 joule per centimeter squared dose, and Group 3 received a placebo before doing their exercise training. The findings? All 3 groups experienced significant reductions in pain intensity, increased muscular strength and range of motion of the knee, as well as increased physical functionability. So what that's saying is that exercise is effective for all these things. Now the question is red light therapy in addition to exercise the most effective? And if it is, which dose was more effective? Turns out it was more effective with red light, and the greatest improvements were found in Group 1, who received a red light dose of 6 joules per centimeter squared. Now we're going to look at the exact dose that you would need to apply a 6 joule dose to your knee or any other joint to get that same benefit or a similar one to the people in that study. In the previous study, pain intensity was decreased and muscular strength, range of motion, and physical function were significantly elevated after a dose of 6 joules per centimeter squared. How long do you need to treat your knee with this light here to achieve that 6 joule dose? Well, using a solar powered meter, I've determined that from a distance of 5 centimeters away, the power density administered by this device is 200 milliwatts per centimeter squared. At that power density, or that distance, it would take 5 seconds to administer 1 joule per centimeter squared dose. So multiply that by 6, and what you have is just 30 seconds held 5 centimeters away will administer a 6 joule dose. Apply the light to your joints from a distance of 5 centimeters for 30 seconds for a 6 joule dose. Follow that red light therapy protocol 2 times per week for 8 weeks before exercise, and you should achieve similar results to the people in the study. So, red light therapy scorecard. For both osteoarthritis and rheumatoid arthritis, all of the following benefits were found: reduced pain, reduced inflammation, reduced morning stiffness, and increased range of motion. And of course, with that comes increased quality of life. That goes without saying. Red light therapy could potentially be a life-changing therapy for you. If you enjoyed this presentation, please share it with someone you love. I'm very thankful that you actually sat through this one and listened. Thank you so much. I have a great listenership. Like, comment, all that funky stuff that YouTubers say. And now it's time to create another presentation for you. I'm going back into the trenches. I'll create another fantastic one, and I hope it helps you as well. I hope you learned something from this. If you want to get a red light therapy device, head over to our store. We've got the handheld that you saw in this video, the Body Light Mini, and the full body light at EndAllDisease.com/store. And if you want to learn more about red light therapy, check out my #1 best-selling book, Red Light Therapy Miracle Medicine. I've also written 2 other best-selling books on cancer, one called The Cancer Industry and the other called Cancer, the Metabolic Disease Unraveled. To take a look at these books, check out EndAllDisease.com/books. And if you want the show notes of this, you can check out the slideshow, the video, and the podcast, and the written article. Go to EndAllDisease.com/episode 18. And while you're there, don't forget to sign up to our mailing list to be notified of new episodes, red light therapy giveaways, contests, and all sorts of other things, and all my life's work as it happens in real time. Join the fun. Join the fun. Here are the references to the show with clickable links, so I encourage you, as always, to read them for yourself. Once again, I'm Mark from EndAllDisease.com. Thank you for listening and watching and reading, and we will see you and hear you. Actually, you'll see and hear me in the next episode.